Keratoplasty is a term, is an ophthalmology term, and other name for this one is penetrating keratoplasty or corneal transplant. So this is basically classified into tectonic type, pathological type, and cosmetic type. So tectonic type means just to safeguard the globe, we do a graft. Pathological type means it may be due to a condition of uh, corneal perforations and severe corneal ulcers and all that. We will do that. And pathological graft means there are certain conditions like keratoconus, some curvature problems in the cornea. We do the keratoplasty. So basically, the donor button is taken from the cadaveric eye. Usually within 6 to 8 hours, we have to remove that corneal button from the dead cadaver. Either we can bring the whole eye and separate the graft from the eye and preserve it in the lab, or else we can remove the button itself from the cornea of the patient's eye and put it in a small bottle medium and bring it to the lab. And when the indications are suitable, we can do the grafting on the patient according to the need. So this is done either under general anesthesia or local anesthesia. So the size of the graft, the donor button, and the recipient bed also differs. Usually the donor button is 0.5 millimeter more than the recipient's hole. But in case of keratoconus, the donor button size and the recipient hole are both the same. So when we do this one, we can put interrupted sutures or the continuous sutures or combination of both. And usually it takes about half an hour to 1 hour according to the patient's conditions and situations. And the recovery usually takes 2 weeks to 1 month. And before we doing the graft, we have to do a specular microscopy on the graft to study the endothelial cells. That means to see the number of cells and type of cells, size, shape, morphology, and all that. So once everything is healed, patient is being followed in the clinic, and accordingly to the refraction done, we used to either remove the stitches or add more stitches, or in that way we titrate the patient. And after 3 to 6 months, we can remove the stitches also. Accordingly, we can give the glasses also.